So, endo currently sits under gynecology. We know endometriosis can affect any part of the body, as you've just shared. Research has linked it to autoimmune disease, and it's more severe than your general menstrual health conditions. And it's even been likened to cancer. Why is endometriosis currently still only recognized predominantly within gynecology? And why aren't other disciplines also specializing in endometriosis? So colorectal, urology, hepatology,
Okay,
cardiothoracic.
well, the dominant symptoms of endometriosis are still pelvic pain, painful periods, painful sex, and infertility. So that makes it more belonging to gynecology than to urology, let's say, right? Traditional uh, first referral to a specialist would be to a gynecologist, although sometimes we have referrals from colorectal and urology, a patient who's gone full circle and went to the in the end got to the endometriosis specialist. The modern endometriosis care is actually multidisciplinary. So I have 4 fantastic surgeons within my team, which are colorectal surgeons. And colorectal surgeons are mostly cancer surgeons, right? So the cancer surgeons, or they treat the inflammatory bowel disease. And these
Yeah.
surgeons also specialize in endometriosis because over the years, I have attracted them, first of all, as fantastic surgeons, fantastic clinicians. And then we learned together, and we learned that the evidence, we learned from other people, we learned how is best to operate on colorectal endometriosis, because the surgery, even if we're talking about bowel resection, the bowel resection for endometriosis is different from bowel resection which you have for colorectal cancer, because it's not cancerous. Endometriosis, we do a very economical, very nerve-preserving bowel resection. And that's what makes a colorectal surgeon a colorectal endometriosis specialist. It's important to have an understanding colorectal surgeon, understanding urologists, and urologists are mostly reconstructive urologists, the guys who can really remove endometriosis and reconstruct and urinary tract, like reimplant the ureter or reconstruct the bladder, and not cause severe nerve damage. And also cardiothoracic surgeons, they would know that endometriosis is not a lung cancer, so you don't have to remove half of the lung to treat endometriosis. And that's what makes a specialist center, MDTs, a very different breed of surgeons, because they are specializing in endometriosis. We think it's the only way of treating a very complex, multi-organ, multi-systemic disease involving multiple parts of the body.